Hello, my name is Kayla Soave, and I will be presenting the study entitled The Acute Effects of Resistance Exercise on Arterial Stiffness in Females. Arterial stiffness measured using carotid-to-femoral pulse wave velocity is an independent predictor of cardiovascular events in adults. In Figure 1, we can see carotid-to-femoral pulse wave velocity pre and post aerobic exercise shown in black squares and resistance exercise shown in the open triangles. After acute aerobic exercise, pulse wave velocity decreases, meaning a decrease in stiffness, indicating aerobic exercise provides a favorable vascular stimulus. With chronic training, aerobic exercise can prevent and reverse arterial stiffening. Alternatively, acute resistance exercise may increase carotid-to-femoral pulse wave velocity, as shown in Figure 1. And the findings with resistance training are inconclusive, either showing an increase or decrease in carotid-to-femoral pulse wave velocity post-training. ACSM states that a resistance exercise session should include an aerobic warm-up, conditioning, and cool-down phase. However, resistance exercise studies have not reported these phases, which may explain the inconclusive observations. Our purpose was to compare central arterial stiffness in adults pre and post resistance exercise utilizing an aerobic warm-up and cool-down. Since aerobic exercise provides a favorable vascular stimulus, we hypothesized a decrease or no change in carotid-to-femoral pulse wave velocity following our resistance exercise bout. Our study had 2 laboratory visits. Visit 1 included muscular strength testing with a 1 repetition max test, and body composition was assessed with bod pod. Visit 2 included pre-exercise measurements of carotid-to-femoral pulse wave velocity, as shown here in this picture. We used a tonometer to obtain pressure waveforms at the carotid and femoral arterial sites and determined pulse transit time as a difference in the arrival of the pressure waveform at each site. Distance measured between sites and carotid-to-femoral pulse wave velocity was calculated as 80% of the distance divided by pulse transit time. We also measured mean arterial pressure. Our participants then went on to complete a 7-minute warm-up on a treadmill with light to moderate exercise at 50% of the heart rate reserve. Our resistance exercise included 7 exercises targeting all major muscle groups at 60 to 80% of our 1 rep max, 3 sets per exercise with 2 minutes rest in between. Then we had our cool down, which consisted of 7 minutes of light to moderate intensity. We repeated our measurements of carotid-to-femoral pulse wave velocity and mean arterial pressure measurements at 15, 30, 45, and 60 minutes post-exercise. Pre and post-exercise carotid-to-femoral pulse wave velocity and mean arterial pressure were compared using repeated measures ANOVA. Our results are here. Our participant characteristics are shown in Table 1. We had 8 females complete the study. On average, they were 23 years old and had normal resting blood pressure. Figure 2 is showing the individual carotid-to-femoral pulse wave velocity values at pre-exercise and each time point into post-exercise. There was no difference in carotid-to-femoral pulse wave velocity across these time points. We also measured mean arterial pressure, and since carotid-to-femoral pulse wave velocity can be affected by mean arterial pressure, we are showing here in Figure 3 the average mean arterial pressure at each time point, and we found a time effect where 15, 30, and 45 minutes post-exercise, mean arterial pressures were lower than 60 minutes post-exercise. The findings from this pilot study suggest following the ACSM's exercise prescription for resistance exercise did not elicit an acute increase in arterial stiffness. The limitation of our study includes only examining healthy females and a small sample size. However, our data collection is ongoing and the findings may change with an increase in sample size. We also only examined carotid-to-femoral pulse wave velocity after 1 exercise session. Therefore, future studies should look at the effects of this resistance exercise prescription on carotid-to-femoral pulse wave velocity with chronic training and including males in their sample size. I would like to acknowledge those who helped me with data collection and the College of Education at Michigan State University. Thank you.